Welcome to Module 7. Our participant is enrolled. Now they need to follow the trial's visit schedule. In this module, we are looking at visit management, how Salesforce Life Sciences Cloud tracks the schedule activities that define a clinical trial participant journey. In a clinical trial, every patient visit has a purpose defined by the protocol. At a baseline visit, the patient's starting condition is documented, labs are drawn, assessments are made, and this data becomes the reference point for measuring the drug's effect. At treatment visits, the patient receives the study drug or placebo, and assessment continue. At follow-up visit, the team monitors what happens after treatment ends. Each visit generates data. If a visit is missed or happens outside its schedule window, that's potentially a protocol deviation. And deviation needs to be tracked, assessed, and in some cases reported. Most trials have a defined set of visit types. The screening visit happens before enrollment and is used to assess eligibility. The baseline visit is at the moment of enrollment. It establishes the starting point. Treatment visits happen on a schedule defined by the protocol, sometimes weekly, sometimes monthly. Follow-up visits continue after the treatment phase. The end of study visit is the final schedule contact, and unscheduled visits can happen at any point if the patient has a concern or an adverse event that needs evaluation. Even without a dedicated division, the visit records still let us explain the concept well. Schedule versus actual timing gives the team the raw information they need to spot the document protocol variance. The visit records are intentionally lightweight, so I will focus on visit name, status, plan start time, and the linked account. Now let's look at one of the record in Salesforce. So this particular visit is for a particular place. The status tells us whether it is completed or not. Then we have it is for which particular account. Then what was the plan start time? When was the actual start and end time? And then we have a visitor such. Let's look at the another one also. So let's look at another visit record. Over here, the visit is planned. The earlier one which I showed you for that particular account, it was completed. So in this slide, we are just comparing the two visits. If you would have seen, the status was completed versus planned. Now, with respect to key takeaways, visit management is the operational heartbeat of a clinical trial. Every visit, every date, every status is a data point aggregated across hundreds of patients and dozens of sites. Visit data tells the story of trial operational health. So going back to this particular visit, so if I look at the related, we can mention the task, visitors, visited parties. If there is any files that needs to be uploaded with respect to this particular visit, we can do that too.